Mental health is seen as a Cinderella. It's hardly ever mentioned. It's hardly ever mentioned by ministers. It's hardly ever mentioned by public policy leaders. And yet, 1 in 4, and yet we spend a fortune as a direct results of mental health dis-ease and crisis, and yet the World Health Organization considers it one of the top 5 killers. So we have a problem in this country in that we can't talk about mental health. We can't really give it the clinical priority that it should have, let alone the public policy priority. In the last 10 years, the biggest intervention in mental health provision has been the increased access to psychological therapies. But we haven't really gone much further. So in London, if you have a stroke, you will be provided with probably the best care in Europe, possibly even the world. We have the best stroke because we redesigned the services to meet the needs of crisis stroke. If I have a mental health crisis and you call the police, I might not get an ambulance at all. What is that about, and what is it costing the system? My hypothesis is that it's costing the system billions, and unless we focus on it and give it the attention, then it will continue to cost us billions. And the future is decided by what you don't discuss, not by what you do. So we need to talk about this stuff because it's going to happen anyway. We've had a system which has held mental health and physical health separately. That no longer is either viable or appropriate. The critical thing is that NHS England's board need to bring it into the mainstream discussion. We've had a great debate around it, but it's a real challenge for the board because we get lobbied, of course, by every disease group, by everybody, with very clear, rational reasons why their particular issue should be taken urgently. But the mandate is very clear. We have to create a system in which parity of esteem between physical and mental health is experienced and proven. That's not an easy thing. We have to understand the implications of that, and we have to deliver it. And we can't have people with mental health challenges dying 20 years younger than everyone else, not from mental health illnesses, but from physical health illnesses. That is unacceptable, and we have to bring the two together. We need to be holding the ring around a number of engagements. So criminal justice, education, all have impacts on public health. They all do. And they all need to add value to making individuals and communities healthy. And one of the few organisations that can help them do that is NHS England. I mean, we actually hold the ring. So the future strategy, the future of the NHS, we must play a bigger role in encouraging, holding to account, engaging, along with our other organisations like Public Health England, in ensuring that actually everybody's adding value, because, everybody wants to be healthy. This is important because it's their service. It's not my service. It doesn't belong to NHS England. It doesn't belong to the system. It belongs to the people. I mean, literally belongs to the people. So if we don't understand, engage, co-design and work with them, then the question could be quite rightly asked, who is the system for? So it's that important, that it's their service. Of course they should be involved in its design and, in my view, and more of its delivery. If you look at virtually every other aspect of life these days, from supermarkets to banks, they spend an awful lot of time trying to understand us in order that they can design services to meet our needs. The one place where that doesn't happen enough is in a lot of services to the public. And so what you end up with are services designed for the needs of the system rather than the needs of the customer. Turning Point is a social enterprise providing health and social care interventions in about 200 locations in England and Wales. Mental health, learning disabilities, primary care, community commissioning. These are all the things that Turning Point does. But one of the things that we've noticed is that the same people, it's the same people, and they tend to be poor and at the sharp end of the inverse care law. Over the years, what we've realised is that actually we need to design services with those people. We need to involve them in the delivery, and if we can do that, actually we get better outcomes. So Turning Point has been focused on integration, and as part of that, we also understand that mental health and the integration of mental health is critical to most people that we work with. My message to everyone at this event, other than I'm really sorry I can't be there because it sounds really exciting, is that what you're doing is the future. The future of the NHS lies in it belonging to people, designing services that they understand and can use and actually can be involved in delivering. So what you're doing today is putting fuel in the rocket, which is going to take us to the future NHS.